So let's go talk to an employer for a minute. Charles Maymon is with American Ambulance, and American Ambulance is a national company, is that correct?
Well, American Ambulance itself was a company that began and has its roots in South Florida. So it was at that time and through that process that I met Newton. Actually, the way that started with us, Newton met our human resources manager, Mary, who's in the audience today. And Mary came to me and talked to me about the program, and I said, okay. And we began a relationship with Newton. Newton gave us 3 employees, 3 new employees. All 3 of the employees originally became emergency medical technicians. And I'll just focus and talk to you about them as individuals for just a moment. One of them became an emergency medical technician, was with us for about 6.5 or 7 years, decided that he didn't really enjoy it all that much, and now is the pastor of a local church in Fort Lauderdale, Florida, and we're very, very proud of him. The second gentleman is an EMT, emergency medical technician, with us today, remains in our employ, and has done an outstanding job. And he also remains an employee of American Ambulance Service. And the third gentleman, who's in the audience today, is somebody that I really want to spend a couple of moments with you talking about. His name is Quentin Washington. Quentin Washington is a rock star in the emergency medical services world. When Quentin arrived, of course, he was coming to us from, his past environment and and his background was what it was. Quentin became an emergency medical technician. Quentin then became a state licensed Florida paramedic. Quentin, from there, moved on to become a critical care transport paramedic. And for those of you who don't quite understand the world that, and the work that we do, when we talk about a critical care transport paramedic, Quentin doesn't respond to 911 calls. Quentin responds to a patient who's lying in an intensive care unit in a hospital, who's in the most critical of situations, is extremely ill, and the hospital that they're in cannot care for them. Quentin is responsible for the movement of that patient from hospital A to hospital B, where they can receive definitive care. He moves patients who are on ventilators. They may have 5, 6, 7 IVs running. He understands the drugs, the mechanism. He can read a 12-lead EKG, interpret it. He's carrying 60 drugs on board his ambulance, and he's handling the sickest of sick patients. That's what a critical care transport paramedic does. He has a certification through Cleveland Clinic of Ohio to do this. So we are extremely proud of him. And now, as healthcare evolves and paramedics begin to deliver a different level of service, we have now moved into the world of community paramedics. And for those of you who don't know what a community paramedic is a paramedic is a paramedic that will respond to you in a vehicle. He's alone or she's alone in a car. They are there, they'll come to your home, and they are there to stop you or keep you from going to the emergency room. They will treat you and provide a myriad of services, carrying some 75 drugs on board, working with through telemedicine online with physicians, and now Quentin has achieved this certification and will be one of the first paramedics in the state of Florida to deliver these services. Quentin, stand up.
Hey, Quentin, it is okay to smile. It's a good thing.
If you don't mind, I just also wanted to point out to you, on the flight up here from Miami, he and Mary came up together yesterday, and they were on a commercial airliner, and they called and said, we have a medical emergency on board. I fly quite a bit, but I never seem to run into this stuff. But Quentin was able to diagnose a potential deep vein thrombosis on a woman and prescribe treatment, and was able to tell the captain that he was able to keep the plane en route to D.C. and that he thought the patient would be just fine to be treated upon arrival.
Wow. You can't make this stuff up.
So great story. So let me go back a little bit. When Newton and OIC first called you or communicated with Mary or whoever in your company, did you guys say, what is this? what's this about? Or did you find them? How did that happen, and what were your original feelings when they said, hey, we've got these former offenders we'd like you to hire?
I want to tell you that Newton's great at his job. And, so Newton recruited Mary. It was easy. Mary came into my office and told me the story, and I won't say I wasn't dubious at first.
For sure.
As anybody
would be.
But I've got to tell you that our involvement with the program and with Newton, with OIC over the years has just been tremendous. We want to continue, and we'll continue working with Newton and OIC. It's a program that we are able to grasp and to understand as an employer. In our world in emergency medical services, taking somebody who's returning to the workforce and allowing to become an emergency medical technician. And by the way, we have folks that will move on into the public sector. Into delivering into fire service, becoming fire rescue paramedics, and doing these, providing these services. So we see it as a real plus. We really do. And I'll tell you one last story. It could have been anybody that came to us from OIC, but it just happened to be Quentin, and it's one of Mary's favorite stories. Quentin was a very new employee at the time, and he was driving a car that was in pretty tough shape, and he had to get to work, and his car broke down on the Palmetto Expressway. For those of you who are from Florida, if ever, it's a heavily traveled road. Got his car to the side of the road and probably walked and ran about 2.5 miles and made it to work on time. And when he was asked, when he was asked by his supervisor, Quentin, why didn't you just call us and tell us you were going to be late, or aren't you worried about your car? Quentin's response was, I can replace the car, I can't replace my job. So that alone, if that gives you any indication of what we've gotten through through OIC and the federal bonding program, it's treasure.
I think those are excellent stories. Congratulations, good job. Don't let him go anywhere unless he's moving up. The bonding program helps provide an opportunity. I think there are thousands of Quentins all over this country who really can do well, and if they're it breaks stereotypes and provides opportunity and gets, Mary had to figure it out. You as an employer had to, that is your business. That's what you do every day. And taking risks, is a little bit of a challenge. It sounds like you've worked on a great partnership. Again, through the federal bonding program, there's partnerships like this all over the country. This is an example of one in Florida that is fantastic. We all should be proud about the partnership you did. And you as an employer should be especially proud and of your staff for taking these risks, but for you for sticking with it over time. Really says quite a bit about your company and you as a person. So thank you.